Matt Taibbi put together brilliantly over in Rolling Stone about where we're at with this healthcare legislation. Our overall question for the hour: why does America have the most sick and twisted healthcare system in the world? And why, in all probability, even though there's all this talk of reform, are we going to end up a year, 2 years, 3 years from now continuing to have the most sick and twisted healthcare system in the world, at least in the developed world? You couldn't put us up against Zimbabwe, I assume, but Matt Taibbi in the current issue of Rolling Stone lays out basically what's already happened. And frankly, there were pieces of it that to me were a shock, and I thought I was well informed on this. So I want to share with you some of the things that I learned from reading this and that I've been able to corroborate in the research that I've done over the weekend. This is pretty solid stuff. The obvious things we've talked about, Chuck Grassley has received over $2 million from the health insurance industry. NZ, all these senators that are making these decisions, particularly the so-called blue dog Democrats, they're just rolling in dough from the health insurance industry to the point that you've got some members of the House of Representatives now, including my Congressman Kurt Schrader from here in Portland, Oregon, who says he wants to become a member of the Blue Dog Democrats. Why? Well, you can ask him, but I would guess the fact that the Blue Dogs are suddenly getting huge gifts of money from the health insurance industry sure will help his reelection, given that people get elected based more on what they spend than who they are and what kind of stands they take, tragically. So anyhow, you have all this money. Olympia Snow took $756,000. NZ took $627,000. Grassley took over $2 million. Those are the three Republicans in the Gang of Six. The Democrats in the Gang of Six are taking millions of dollars as well from the health insurance companies. We have 1,300 different major insurers in the country, or different insurance policies, plans in the United States. Nearly a third of all the money spent on health care. Now, this is after you've set aside the $700 million for compensation for Stephen Hemsley, the president and CEO of United Healthcare, and the tens of millions of dollars in compensation for the other CEOs. It's after you've set aside that. This is after you've pulled off the tens of billions of dollars in dividends that are being distributed every year to the stockholders in these companies. After all that, nearly a third of all the money that actually gets, quote, spent on health care is spent by people like your doctor and my doctor, your hospital, my hospital, your medical clinic, trying to fill out forms. And the health insurance companies try to fight the payments. So about a third of it is a third of all of our health care dollars are spent on administration that in Canada, if you walk into a doctor's office or a hospital, it's one form. Very often in some countries, you don't even need to sign anything. All you have to do is show the card. And then the doctor's office fills out one form. In other words, a third of our healthcare expenses, we're spending about twice as much as anybody in the world in healthcare, and about a third of that is just paperwork. So the first thing the Obama administration should do is get rid of all that paperwork. How do you do that? With a single-payer healthcare system. But they've chosen not to do that. So we're going to continue to have a third of our healthcare dollars be wasted in administration. Now, you're going to hear a lot of talk about, we're going to put medical records in place. Great new business for Diebold, or ES&S, right? A great new business for the computer industry. And maybe it'll slightly diminish it, but it's putting a Band-Aid on a cancer. Step 2, Matt Taibbi talks about in his current issue in the current issue of the Rolling Stone. The article, by the way, is called Sick and Wrong: How Washington is Screwing Up Healthcare Reform and Why It May Take a Revolt to Fix It. And I think it is going to take a revolt. Step 2, gut the public option. The original idea of a public option was something that anybody could buy into. Right? That's what we all think that we're talking about when we're talking about a public option. And that is reimbursing physicians at a rate similar to Medicare. The original proposal for the public option was Medicare plus 5%. And that is reimbursing drug companies based on the ability to negotiate drug prices. And that reimburses hospitals based on competitive bids. Basically a company or a healthcare plan run by the government that is actually operating like a competitive business. That was what was originally proposed. Then the Blue Dogs got there. Then the Blue Dogs came in. And the Blue Dogs said, you know, we don't like this idea of a public option that actually can compete with health insurance companies. So do away with the reimbursement of Medicare plus 5% and instead make all the reimbursements individually negotiable. Now, collectively negotiable would mean that you could actually negotiate down prices. Individually negotiable means you're going to pay what the insurance companies are paying. You're going to pay, or you're going to pay what it's costing them, plus all of their administrative costs. In other words, according to the math that Matt Taibbi lays out here in Rolling Stone, about an additional, the public option just became $1,800 a year per family in the United States more expensive. In other words, it won't compete. It won't be a lot cheaper than buying private health insurance, which, of course, is exactly what the Blue Dogs wanted. They say that they're all, I'm a Blue Dog, I'm a fiscal conservative. Bull. The Blue Dogs are are corporate whores. That's what they are. Pure and simple. And this is the proof of it. They're coming in and they're saying to the Democratic administration, do not let this public option be truly competitive against the for-profit corporations, because those for-profit corporations are shoveling piles of money into our back pocket. The way Taibbi says it, on July 9th, in a harmless-sounding letter to Pelosi, 40 Blue Dogs expressed concern that doctors in the public option, quote, must be fairly reimbursed at negotiated rates and their participation must be voluntary. Paying doctors using Medicare's below-market rates, they added, would seriously weaken the financial stability of our local hospitals. It was a lie, and they knew it was a lie. It was an end run around the political, as Matt Taibbi says, it was an amazing end run around the political problem posed by the public option. In other words, it would be cheaper than for-profit health insurance. As Taibbi says, the Blue Dogs were demanding that the very thing that makes the public option work, curbing costs to taxpayers by reimbursing doctors at Medicare rates plus 5%, be scrapped. Instead, they wanted compensation rates for doctors to be jacked up on the government's tab. Now, Congresswoman Woolsey says costs should be the number one concern of the Blue Dogs. That's why they're Blue Dogs. Right. Sorry. As Taibbi says, in one fell swoop, the public plan went from being significantly cheaper than private insurance to costing, well, about the same as what we have now, as one Senate aide puts it. So the party is now going to sell voters on the idea that it's offering a public option without technically lying, while at the same time reassuring healthcare providers that the public option it's passing would not imperil the health insurance industry's market share. Even more disgusting, when on July 31st, Nancy Pelosi was asked if progressives would pull out because of this sellout to the Blue Dogs, she laughed. She literally laughed. She said, are the progressives going to take down universal quality, affordable care for all Americans? I don't think so. Chuckle, chuckle, chuckle. Yeah, right. Okay, step 3, pack it with loopholes. The most glaring example of this, passed by Ted Kennedy's Help Committee, would allow the makers of complex drugs known as biologics to keep their formulas from being copied by rivals for 12 years. In other words, extend patent protection. So the government, the public option has to continue to pay for patented drugs even after there are generics. So first the doctors and the hospitals get their piece of it, and the health insurance companies are assured, don't worry, nobody's going to compete with us. Now the pharmaceutical companies, don't worry, the public option, yeah. And then the third, this is the real killer, is this thing of you're being able to buy into the public option. We thought any of us would be able to buy into the public option, right? Wrong. It looks like the way this is going to play out is if your employer is offering you health insurance, then you turn it down, then you cannot buy into the public option. You have to take your employer's health insurance or nothing. And a lot of employers are offering some damn crummy health insurance, Walmart being the most notorious of all. And in fact, a lot of people who work at Walmart say, no, I'm not going to take your health insurance. I'm making so little I qualify for Medicare or Medicaid, and they're taking state Medicaid for poverty. Now they won't be able to.